Good morning, doctor. Today I thought we could discuss bariatric surgery, its indications, types, and procedures. Bariatric surgery is primarily indicated for patients with a BMI of over 40 or over 35 with obesity-related comorbidities.
That's correct. The aim is to reduce the patient's risk of obesity-related health issues, such as type 2 diabetes, hypertension, and sleep apnea. Let's also touch on the different types of bariatric surgeries.
The most common types of bariatric surgery are Roux-en-Y gastric bypass, sleeve gastrectomy, adjustable gastric banding, and biliopancreatic diversion with duodenal switch. Each has its specific indications and outcomes.
Indeed, gastric bypass, for instance, involves creating a small stomach pouch and rerouting the intestines, which not only limits food intake, but also causes malabsorption. Sleeve gastrectomy removes a portion of the stomach to reduce its size.
Let's go into more detail. During gastric bypass, we create a small pouch from the stomach and connect it directly to the small intestine, bypassing most of the stomach and the first part of the small intestine.
And with sleeve gastrectomy, we remove about 80% of the stomach, leaving a tube-like structure. This procedure significantly reduces the stomach's capacity and the production of hunger-inducing hormones like ghrelin.
Post-operative care involves close monitoring of the patient for complications like bleeding, infection, and leaks from the surgical site. Patients typically stay in the hospital for a few days.
Additionally, smoking cessation and optimizing control of comorbid conditions like diabetes and hypertension are essential. Patient education about the surgery, recovery, and lifestyle changes is also a critical part of preparation.
Pre-operative preparation is crucial. Patients need thorough evaluations including nutritional, psychological, and medical assessments. They must also adhere to a pre-operative diet to reduce liver size and intra-abdominal fat.
Yes, and they must follow a specific diet progression post-surgery, starting with liquids and gradually moving to pureed foods, then soft foods, and finally regular healthy foods over several weeks. Nutritional supplements are often necessary.
Long-term management focuses on lifestyle changes, including diet and exercise, to ensure the success of the surgery. Regular follow-up appointments are critical for monitoring nutritional deficiencies and potential complications.
Yes, and they must follow a specific diet progression post-surgery, starting with liquids and gradually moving to pureed foods, then soft foods, and finally regular healthy foods over several weeks. Nutritional supplements are often necessary.
Let's discuss potential complications. Early complications can include bleeding, infection, and leaks. Late complications might involve nutritional deficiencies, bowel obstruction, or gallstones.
That's right. Nutritional deficiencies are particularly common, so patients need regular blood tests and may require lifelong supplementation of vitamins and minerals, like vitamin B12, iron, calcium, and vitamin D.
The outcomes of bariatric surgery can be quite significant. Patients typically lose 60–80% of their excess weight within the first 12 and 18 months. This weight loss can lead to the resolution or improvement of comorbid conditions.
Absolutely. The improvement in conditions like type 2 diabetes can be dramatic, sometimes within days of surgery, due to hormonal changes. However, success largely depends on the patient's adherence to lifestyle changes.
Patient selection is vital for the success of bariatric surgery. Not every obese patient is a candidate. We must ensure they understand the risks and are committed to the required lifestyle changes post-surgery.
Psychological evaluation is part of this process to identify any mental health conditions that might affect post-operative success. Patients with untreated eating disorders or severe depression may not be good candidates initially.
Technological advances have improved bariatric surgery outcomes. Minimally invasive laparoscopic techniques reduce recovery time, pain, and complication rates compared to open surgery.
Robotics is also making an impact, providing greater precision and flexibility during surgery. These innovations are enhancing patient safety and outcomes, making bariatric surgery more accessible and effective.
Revisional surgery is sometimes necessary for patients who experience complications or insufficient weight loss from their initial surgery. It's complex and requires careful evaluation and planning.
Correct. Reasons for revisional surgery can include anatomical issues, pouch enlargement, or failure to lose adequate weight. These cases require a highly skilled surgical team to ensure safety and success.
Looking to the future, research is ongoing into new surgical techniques and less invasive methods, such as endoscopic procedures. These could offer effective weight loss solutions with even fewer risks.
And there's also a focus on understanding the metabolic changes post-surgery to develop better non-surgical treatments. Personalized medicine approaches could tailor interventions more precisely to individual patient needs.
Patient education is a cornerstone of successful bariatric surgery. Ensuring patients understand the procedure, risks, benefits, and necessary lifestyle changes is crucial.
Agreed, education should be continuous, starting preoperatively and extending long-term. This includes dietary counseling, exercise guidance, and psychological support to help patients maintain their weight loss and health improvements.
A multidisciplinary approach is essential for optimal outcomes. This includes surgeons, dietitians, psychologists, and primary care providers working together to support the patient throughout their journey.
Each team member plays a crucial role. Dietitians help with nutritional plans, psychologists provide mental health support, and primary care providers monitor overall health and manage comorbid conditions.
Let's talk about insurance and cost. Bariatric surgery can be expensive, but many insurance plans cover it if certain criteria are met, such as documented failed attempts at weight loss and the presence of comorbid conditions.
Yes, obtaining approval often requires thorough documentation and sometimes a supervised weight loss program. Patients should work closely with their healthcare team and insurance providers to navigate this process.
Primary care providers play a pivotal role in the bariatric surgery process, from initial referral to ongoing postoperative care. They help manage comorbid conditions and ensure continuity of care.
They also provide essential support in the preoperative phase, ensuring patients are optimized for surgery and well-informed. Postoperatively, they monitor for complications and assist with long-term management.
Beyond weight loss and medical benefits, bariatric surgery significantly impacts quality of life. Patients often experience improved mobility, self-esteem, and social interactions.
Indeed, the psychological benefits can be profound, reducing symptoms of depression and anxiety related to obesity. It's important to address and support these changes as part of the comprehensive care plan.
Pediatric bariatric surgery is a growing field for adolescents with severe obesity and related health issues. It requires careful consideration due to the potential impact on growth and development.
Innovations like endoscopic sleeve gastroplasty and intragastric balloons offer less invasive options. Understanding the gut-brain axis and hormonal changes post-surgery could lead to more targeted therapies.
Ongoing research is essential for advancing bariatric surgery. Studies are exploring the mechanisms behind weight loss and metabolic changes to develop new treatments and improve existing procedures.
Absolutely. A multidisciplinary approach and ongoing patient education are key. As technology and research continue to evolve, bariatric surgery will become even more effective and accessible, helping more patients achieve lasting health improvements.
In conclusion, bariatric surgery is a powerful tool against obesity, offering significant health and quality of life benefits. Success relies on careful patient selection, comprehensive preoperative preparation, and long-term support.